Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for today's briefing. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Good afternoon, everyone. Today we're reporting one new case of COVID-19. The new case is in the Central Zone and related to travel outside of Atlantic Canada. There are now 9 active cases in the province. We've had a good run in the last number of weeks, reporting single digits to 0 cases of COVID. Other provinces have not been so fortunate, including our neighbours across the Atlantic, Newfoundland and Labrador. That province is experiencing an outbreak, so today we are confirming that anyone coming into Nova Scotia from Newfoundland and Labrador must quarantine immediately for 14 days. Dr. Strang will have more details. This is another example of how quickly COVID can take hold. I want to thank all of you for your hard work and cooperation in keeping everyone safe, especially during this time of transition. As you know, I will be leaving office soon. We have a new leader in Premier-designate Ian Rankin. I want to congratulate the Premier-designate. He has been part of my government for the last 7 years, and we are working through a transition period. And during that time, I will continue to sit here with Dr. Strang to work with public health and all of you to ensure that we stay on the right track in dealing with COVID. That, of course, is our #1 priority. Some good news on the vaccine. We are continuing to work with the federal government on supply. This week, we are expecting a shipment, and we'll have a larger one next week. As the shipments roll in, we are continuing to administer the second shot into thousands of our frontline healthcare workers' arms. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And I would like to offer my congratulations to Premier-elect Rankin. I look forward to working with him to protect the health and safety of Nova Scotians. So we have another day reporting only one case, and it's been since January 24th was the last time we had a case where there was it wasn't directly and clearly related to travel. So that's over 2 weeks. This is all really good news, and again demonstrates that our comprehensive approach of quarantining, testing, follow-up of cases and contacts is working. But it's important to remember how quickly that can change. Just look at our neighbors in Newfoundland. They announced 30 cases today. I had a phone call with their chief MOH, Dr. Fitzgerald, yesterday. They're dealing with several clusters. She was anticipating this, but I'm not sure she was even anticipating 30 cases. So because of that risk, mostly centered in St. John's, like we responded to when a similar situation in New Brunswick, we are imposing now anybody coming from Newfoundland and Labrador will have to undergo a 14-day quarantine, and we'll be working over the next day or so to work out the details of that. Again, this is a reminder of how quickly things can change. So I want to thank all Nova Scotians for their continued cooperation, especially as we cautiously ease the restrictions. Your patience with our slow, cautious approach and your ongoing commitment to maintaining the COVID protocols for yourself and for your family. So for this week's vaccine update, I will just start with recapping where we're at with our vaccine supply. So since December 15th, we've received almost 34,800 doses of COVID-19 vaccine. And this includes the 5,950 doses received to the end of last week. And we have administered 18,826 doses to date, and that includes some people who are starting to receive their second dose, and the majority of the remainder is now set aside for others as they come due for their second dose. There is more data, substantively more data on the supply and the doses administered on our data website and the dashboard that we update every Tuesday. And this week, we are expecting to receive 1,950 more doses of Pfizer vaccine. And again, half of that will be reserved for second doses. And the good news is next week, we will get the single biggest shipment of vaccine to date, 8,775 doses of Pfizer vaccine. And we will certainly be ramping up our vaccine program to administer that amount of vaccine as quickly as possible. So this week we have 4 healthcare worker clinics running in Halifax, Truro, Kentville, and Yarmouth. 4 more long-term care facilities will be receiving their vaccine this week, and second dose clinics for some of the long-term care facilities will also be starting this week. So I want to thank the healthcare workers, long-term care staff and residents, and designated caregivers who have been coming forward to receive the vaccine. I know people have wanted the vaccine, and we are working on our limited supply to administer this vaccine as quickly as possible. But I thank those people, both for their patience, but also for coming forward and being willing to receive this vaccine. We know it's an important step, and we want everybody who can get vaccinated to get vaccinated. To that effect, last week I announced that the first prototype community clinic would take place at the IWK in Halifax. This clinic will immunize Nova Scotians who are 80 years of age and older, who have been randomly selected by postal code that's within an hour's distance of the clinic site. Those people will be, those able to register will receive a letter from Medavie this week about the details of the clinic and how they can book their appointment. We have 1,000 doses of vaccine that have been set aside for this prototype clinic, and that's for first and second doses. That means that 500 people will be immunized through this clinic. It will run for 4 days starting February 22nd. If you are a Nova Scotian over 80 years of age who receives an invitation to be part of this clinic, or a caregiver of someone who is able to attend, let me just run through what you need to know about this clinic. The invitation letter is intended only for the person who receives the letter. It cannot be transferred or extended to another individual. It is based on age and health card number. You will need to book both your first and second appointment at the same time, and the second appointment will be 21 days after the first dose. You may bring one support person to assist you on the day of the appointment, but that person will not be eligible to receive the vaccine. If people have any serious allergic reaction to any of the ingredients in the vaccine or have an autoimmune or immune system problem, they should be talking to their family doctor, nurse practitioner, or their local pharmacist before they book their vaccine appointment. We know that not everyone who receives a letter will be able to or want to receive the vaccine at this time, and we have planned for that, so we have sent out slightly more letters than there are available appointment times to ensure that we have fully booked clinics and do not waste a vaccine. If you receive a letter but are unable to book at this prototype clinic because it is full, you will be able to receive your vaccine at future community clinics. This is only the prototype clinic. We're doing this to learn how these type of clinics run, and once we get much more robust vaccine supply, we will be having community clinics starting with those 80 plus throughout the province. We're also moving forward with establishing prototype clinics in both pharmacy settings and in our Mi'kmaq communities. While much of this is still in the planning stages, what I can tell you today is that we will be beginning 4 pharmacy prototype clinics in early March. And these will be in Halifax County, Cumberland County, Shelburne County, and Inverness County. And more details will be announced at a future date. We're also working with our Mi'kmaq communities to provide prototype vaccine clinics. These communities, we will be supporting them, but the communities will be running their own clinics in their health centers, and we will providing logistic support, providing the vaccine and other materials to help them run their clinics. Details on when and exactly when and where are still being worked out, and we'll be providing an update in a couple of weeks, and certainly working with our Mi'kmaq communities for them to be doing communication within their community. So since announcing the easing of restrictions last Friday, we have been receiving a number of questions about wearing masks in public. I want to remind people there have been no changes to our mask requirements. Wearing a non-medical mask continues to be required in indoor public places, and public health recommends at indoor private places and all outdoor spaces that if you cannot reliably keep at least 2 meters from other people, you should be wearing a mask. And the mantra, your motto should be, when in doubt, mask. And wear a mask unless you have a valid medical reason not to. I have to say it again, please do not look for excuses or loopholes. Wearing a mask is one of the key ways that you can keep, and a very visible way of showing how you care about others and how you're going to help keep them safe. And remember that a face shield does not replace a mask. Masks are required when you are a spectator or a member of an audience or a congregation that we've opened up now. There may be some activities where a mask may be removed, but I would ask you to check with the activity's specific return to play or reopening plan to validate that and get more details. In restaurants and licensed establishments, masks may be removed when eating or drinking, but it should only be when these are actively happening. When you're at a restaurant or a licensed establishment, wear a mask while you're seated if you're simply talking to each other. And certainly you need to wear a mask if you're up and about as you're entering and leaving, if you're getting up and going to the washroom. It has also come to my attention there is some confusion around restrictions around people who are self-isolating and what they are allowed to do for outdoor exercise. To accommodate people's physical and mental health, people who are self-isolating are permitted to leave their property for outdoor exercise within walking distance of whether they're home or where they're staying for a maximum of 1 hour per day. They must keep physical distance of 2 meters from each other. And if they're in a shared accommodation like an apartment or a hotel, they must wear the mask in the common areas. And when they're out, they cannot go visit other buildings, go to outdoor fitness classes or personal training sessions. So you can go out for a walk or a run by yourself, but no other activities. And this is simply to accommodate people's physical and mental health. Because we know that that doing that is important. It's a way to help people maintain their health while they're undergoing the necessary quarantine. But it's very important that people don't take advantage of that situation and put other members in the community at risk. As we finish off today, I want to thank everyone for their continued willingness to comply with public health measures. Yet again, Nova Scotians are showing that we have the ability and the willingness to do what it takes to keep COVID virus under control. And I have to say again, I appreciate everybody's patience as we slowly and carefully ease restrictions and take the necessary steps to minimize the chance of a resurgence. And it wouldn't be a COVID-19 press conference if I didn't remind folks about the importance of taking all the necessary precautions. Wash your hands, maintain a safe physical distance, wear a mask, as I've just talked about, stay home if you're feeling unwell and do the online assessment to see whether you need to get tested. Keep your social circles small and consistent. Introduce COVID testing as a regular part of your routine and check in on one another and do the check-in safely. And we'll be back on Friday with another update. Until then, keep looking after each other and keeping each other safe.
Tina.
Again, just a reminder, we'll take one question and one follow-up from reporters on the line in the allotted time we have for today's briefing. We'll start with Carolyn Ray from CBC. Go ahead, Carolyn.
Hi there. I just wondered if you could elaborate more on the timing for your decision for the new rules for people from Newfoundland and Labrador, and also what would your recommendation be for Nova Scotians who have plans to travel there in the near future?
So thank you. We made this decision this afternoon. As I said, I was in conversation yesterday with my colleague in Newfoundland, learning more, and my epidemiology team was talking to their counterparts in Newfoundland. When I checked in with my epidemiologist this morning, they updated me. What I'd heard from them was consistent with what I'd heard from Dr. Fitzgerald yesterday, concerning situation in St. John. But then within the last few hours, we heard 30 confirmed cases. So clearly we've always acted quickly and necessarily so when we've had to. And so I think it's important that we now impose the restriction like all other provinces except for PEI now, that if you're coming into Nova Scotia from Newfoundland or Labrador, a 14-day quarantine. And we'll be working out, there's always details around with our border staff and other folks, and we'll be doing that. We just made the decision. We'll be doing that in the next 24 hours or so. We would certainly say to Nova Scotians that, like we said when we imposed a quarantine for New Brunswick, essential travel only to Newfoundland and Labrador this time.
Go ahead with your follow-up, Carolyn.
Okay. And in regards for the clinics for people who are 80 years old and older, I just wondered if you could talk about your decision to inform people by mail. Is there any concern that some of the letters might not be delivered considering the backlogs in the postal system right now?
My teams kind of reassured me that they've worked with both MSI and the mail, and everybody has confidence that this system will work. Again, remembering that for many people in this age group, mail is still a primary way for them to get information.
Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Thanks very much. I'm just bringing a question forward regarding the 5 versus 6 doses with Health Canada recognizing, I guess, that change today. I'm just wondering if that changes things in the province here. Have we been able to get 6 doses yet, or when can we maybe see that, Dr. Strang? Do we have that capacity?
So we've been trying to get 6 doses, and we're getting that roughly 50% of the time. We're aware that of this decision coming imminently from Health Canada. We're still in the process of finalizing what we need to have. There's a special type of syringe that we're working to procure, and a final arrangements being made for that. There's also some training that we'll need to have in place for the people who are drawing up the vaccine. So we anticipate that we'll be, if this actually gets licensed and approved by Health Canada, that we'll be able to start to do this next week, and that would mean that we'll get additional doses. I'll have to do the math, but the 8,775 doses from Pfizer becomes something above 10,000 if we're actually able to get approval and operationalize this. What that means is that we get a bit more vaccine than we expected, but it helps make up for the vaccine reductions that we've had in the last few weeks.
Go ahead, Jesse, with your follow-up.
That's promising. Thanks. In follow-up, I just wanted to shift gears maybe back to this 14-day quarantine. I'm assuming that's effective immediately, but I'm just wondering if you can maybe differentiate between self-isolation and quarantine. What are expected of people who enter from Newfoundland?
It's the same thing. Technically, it's a quarantine. We've been mixing up quarantine and self-isolation, but it's the same thing. It means you have to stay by yourself for 14 days, not have any close contact with anybody else.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, I'm wondering if the province is still considering testing people for COVID at the airport, or if any decision has been made on that.
We're actively looking at it. We have a meeting that's going to be coming up. I was in a discussion with my team earlier today, and we're going to find a time as soon as we can and sit down with the airport and the private company, the lab that they're working with, to start to explore in detail what their proposal might look like.
Go ahead, Natasha, with your follow-up.
Thank you. With Reading Week coming up for universities, I'm wondering how concerned you are about a potential surge in COVID cases. I think you talked about this a bit last week, but what would the message be to university students?
Stay in Nova Scotia, like we said last week. Some universities are only having 2 or 3 days of Reading Week. Some are having the full week. But now is not the time to leave to go to another province, except perhaps PEI. If people go outside, they'll have to do a 14-day quarantine, and we would recommend testing upon their return. But the safest thing to do is stay here in Nova Scotia. We're one of the safest places in the country, so why would you want to go somewhere else right now in the middle of a pandemic?
Next, we'll go to Danielle Edwards from the Canadian Press. Go ahead, Danielle.
Hi, this is a question for Premier McNeil, but I just wanted to ask if there is any information about the transition of power. Is there a date set for the transition that will allow Premier-elect Rankin to take his seat?
No, not as there's no date set that I know of. They're working through that process. Usually takes 2 weeks, 10 to 14 days. But his team was meeting today, and they'll, I'm sure, communicate that to Nova Scotians. But until that point, I'm still the Premier. I will still be in my office making decisions on behalf of Nova Scotians. So I want to reassure Nova Scotians there's not a lull going on here. It's not as if the government doesn't have the authority to make decisions. I still have all the authority I did last week. We as a government, my cabinet, current cabinet, has that same authority until he is sworn in and his new cabinet is sworn in, and I will be here with Dr. Strang up until that day.
Go ahead, Danielle, with your follow-up.
Yes, I also wanted to ask about a comment that Dr. Morrison made in PEI about hopes that the Atlantic bubble could be reinstated as early as April 1st. So this question is best for Dr. Strang, but Dr. Strang, what are your thoughts on that now that we have concrete numbers from Newfoundland?
So I think that makes it, I talked with Dr. Morrison was part of the conversation yesterday with Dr. Fitzgerald. She raised that idea, and I think we all agreed that maybe it's aspirational. We certainly have a lot of work to do, and now Newfoundland, in the situation they're in, makes that even harder. But, April 1st is about 6 weeks away. It's still possible, but we'll have to get there, step by step.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. This would be for Dr. Strang. I'm just wondering, in your conversation with Dr. Fitzgerald, whether you learned how those Newfoundland outbreaks occurred so quickly, and if there are any possible lessons for Nova Scotia.
So a couple of things. They're not sure, the source, and so their biggest concern is that there's some substantive community spread, especially in St. John's. I think a couple of lessons I learned that, one of their situations, and they have a whole high school where they have shut the high school down in large numbers of contacts. Part of that situation was a large volleyball tournament from high schools across the St. John's area. It confirmed to me when we opened up, as we've opened up sports, we've said regular your teams can play as they regularly, a part of their regular schedule, but we are not allowing tournaments that bring large numbers of teams together, and it confirmed that was the right decision that we made in Nova Scotia.
Go ahead, John, with your follow-up.
Thank you. This is for either the Premier or Dr. Strang. The province is engaging with African, Nova Scotian, and First Nations community on the vaccination program. There can be distrust of government medical programs in these communities, and I'm just wondering what the response so far has been from these communities.
Certainly, very positive response. The First Nations communities are actively looking for the vaccine, and the same, we're a bit further down the road with the First Nations communities than we are with the African Nova Scotians communities. But one of the reasons we have reached out and want to work very closely and collaboratively and give those communities as much control as is feasible around their vaccination program is simply so they can bring the right cultural and community approach to the members of their own community to help break down some of the long-standing issues that may lead to a greater vaccine hesitancy in those communities.
I think it's important to recognize that community leaders are a big part of this conversation with public health when we're going into whether it's an African Nova Scotia community or a Mi'kmaq community. And I just want to express my appreciation to the leadership of those communities for being open and working alongside of public health and government to ensure that we, when the vaccine comes in, that we get it out as quickly as possible and as many arms as possible.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. Dr. Strang, when we get into mid or late March, assuming our vaccine supply is as expected, at what rate do you expect to vaccinate Nova Scotians? I'm wondering roughly how many doses per week you're aiming for.
So the vaccine schedule that we have allotted for us, I mean, it's still not guaranteed, but it's more into April, mid to late April, anywhere upwards of 12,000 doses a day now, I've been told. And so we're building a vaccine plan that could deliver that amounts of vaccine on a regular, ongoing basis every day.
Go ahead, Lindsay, with your follow-up.
Thank you. And to follow on some of the questions earlier about the 6 doses in the 5-dose vial, can you tell us a little bit more about the actual sort of equipment and what's being used there to get that 6 dose out of there, as you said, 50% of the time at this stage?
It's simply that to be able to get that last dose of vaccine on a reliable, consistent basis requires it's a special type of syringe. It's called a low headspace syringe, and I haven't actually seen it or used it, but it's a specialized syringe that you can then obtain that extra dose every single time. And so we're in the process of procuring that syringe. Health Canada, as you know, we're working with the federal government. They're also looking at procurement, but we're also doing our own. And there's also a little bit of training that will have to be done once we get the syringes, so all the nurses who are drawing up the vaccine from the vials can learn how to use that. We don't expect that'll take a long period of time, but we have to have those things in place before we can reliably then say we're going to get the sixth dose of vaccine from every vial of Pfizer vaccine.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, Dr. Strang. I recognize there's privacy issues involved, so I don't want you to go there, but the travelers, we're only having travelers now. I'm just wondering, can you give us any idea of what kind of people these are? Are these snowbirds, or are they rotational workers, or what can you tell us about them?
There are a different types. Some of them are rotational workers, and we now have mandatory testing, and some of them are testing. We have long-distance truck drivers who necessarily have to keep bringing our food and other essential goods into the country and into the province. Some of them are testing positive, and there's other business and other type of travelers that are quarantining, and they're following the rules. By and large, they're isolated. If they become sick, we get them testing. So it's different types of travelers. What we're not seeing a lot of, fortunately, is the vacation travelers, because by and large we're seeing people are understanding the need to stay home and not do travel outside of the provinces, outside of the country, unless that's necessary for various work purposes.
Go ahead, Tim, with your follow-up.
Yeah, I think we can say, since no one's catching the disease here, the vaccine strategy of holding back doesn't threaten, or hasn't so far threatened, anyone. But I'm wondering if you've continued to stay on top of the literature and the science on the holding back the second dose in the strict 3-week timeline. Is that something you're still comfortable with?
Absolutely. I mean, the evidence becomes stronger. There was more recent data coming out of Israel, which would suggest that the single dose of vaccine is actually only very modestly effective against providing protection. It's another question about relying on having a single dose strategy, and we continue to discuss this. Our vaccine expert group remains very firm in their position that sticking with our holdback of the second dose and relying on full immunity from 2 doses is the right strategy for Nova Scotia.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. This question is for Dr. Strang, kind of just looking for clarification about whether that 4 days of clinic for the 80 plus, the prototype clinic at the IWK, you said it'll be 4 days. Are those expected to be consecutive? And kind of getting at that, wondering if, as we're in the winter, snowstorms and things, would those shut down a vaccine clinic if a snowstorm happens? And if so, how will Nova Scotians who were set up to get vaccinated be notified that it's shut down?
I believe it's consecutive days. I don't have the full schedule in front of me. We always have to have a contingency plan. If there's a snow day like yesterday, we shut down some of the primary assessment testing centers and vaccination necessarily for safety reasons shut down yesterday. So if we do have to do that, then we especially on the vaccine side, we just adjust our schedule. One of the hallmarks of our work and of our program is building in flexibility in our vaccine program to accommodate primarily increases or decreases of vaccine, but we can also be flexible in terms of catching up on clinics if they have to be shut down for weather or other unexpected events.
Go ahead, Victoria, with your follow-up.
Thanks. And this question is, I know you said in response to a previous question, we're expecting to get up to 12,000 doses a day now by mid-April, end of April. Previously, originally that was 10,000 was going to be kind of our peak or our expected peak. Did that go up because we'll need to make up for the doses we've lost in the past few weeks?
No, that was simply me making my team reminded me earlier this morning that I was using slightly the wrong figure. I said around 10,000, but they have corrected me in a more precise figure, and it's an upward projection, so it's all good news.
Next, we'll go to Maurice Reese from the Shoreline Journal. Go ahead, Maurice. Are you there, Maurice? Thank you very much. That's all the questions we have for today, Premier.
Thank you, Tina. I was really happy to see pictures of parents out at the rink cheering on their kids playing hockey this past weekend, and kids are getting back to their club activities. I know that it has been a while since you've been able to do that, and we're happy to have opened up a little bit so that kids can get back to doing what they love. And it's nice parents can be there to support them. It's still early days since we've opened up, and it's a wonderful opportunity, but we can't take it for granted. It's not something many other provinces are able to do, but because of your hard work in the first wave, by us locking down early, making masks mandatory a lot sooner, and adjusting to follow the protocols much faster, we are able to have some freedom now here in the second wave. But if we veer off course, COVID will sweep in. It doesn't take much for this virus to find a home. I worry about the number of cases. Because our cases are so low, we assume we don't have an issue. But with COVID, there is always an issue. And our job is to outsmart this virus. And the best way to do that is to continue to follow all of the protocols. So when you're at the hockey rink, wear your mask, sit in pods, just keep doing it. The protocols are there for a reason. Enjoy your freedom, but don't let your guard down. Thank you for your cooperation, and we will see you Friday.